Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Vikram Madireddy. He is a neurologist. Today's Kevin MD article is How Japan and the U.S. Can Collaborate for Better Healthcare. Vic, welcome to the show. Thank you so much for joining me from Tokyo today.
Yeah, thank you for having me.
All right, so tell us a little bit about your story and then the article that you co-wrote on Kevin MD.
Okay, well, sure. So I'm originally from New York City, born and raised, and the first time I ever left New York was to go to medical school in the Deep South in Memphis, Tennessee, home of barbecue, Elvis Presley at one point, and I think the Memphis Grizzlies.
Hmm.
Yeah, New York transplant. And then halfway through medical school, I was starting my clerkships, and I actually had an opportunity to go to Japan the first time. Now I'm living in Tokyo. I'm a resident of this country. I'm a guest on a student visa doing medical research, and then I hope to pass the Japanese license one day. But yeah, I've been back and forth a few times, and then I just fell in love with this country out of all the places I've studied medicine, practiced medicine. So yeah, I'm working to establish roots here and try to bring Japanese medicine out to the wider world, including my home country.
All right, so what led you to Japan to do medical research in the first place?
Okay, well, growing up, I was always big into anime, Dragon Ball, Pokemon, all that Saturday morning cartoon stuff. And then you know about like these countries just in the back of your head. Like Japan, you think of samurai, you think of Mount Fuji, you think of, let me think, what's a good example? I don't know, sumo wrestling, the
Hmm.
Emperor, that Bushido Code, World War II. Those are all things that we loosely associate with it. Same as we associate the UK with the Queen, with crumpets, with Mick Jagger, for example. But then once you actually start to delve into it, just like with medicine, it starts to take on a life of its own. You learn new things as you go from it. You go back and forth, you're adding to it. And so one thing I'm doing now is translating Japanese medical textbooks into English, and that really helps me when I practice medicine on the English side. Like I memorize more of the pharmacology, memorize more of the anatomy because I had to take my time. And so how that started, I was doing internal medicine in Nashville, Tennessee, and then I actually had a patient close to my age, and we hit it off because of that shared mutual interest in anime, in Japanese culture. And unfortunately, I later found out towards the end of that rotation, he committed suicide. That like caught me completely off guard. I thought he was okay. You never really know. And then my friend and classmate could see that was bothering me, and he said, "What's something you've always wanted to do to relieve stress?" And he was like, "You know what? I've always wanted to learn Japanese, never
Hmm.
got around to it. It's a very hard language." And then he just looked at me, he's like, "Okay, I'm gonna bet you $20 you can't learn it while doing medical school." And then before I graduated, I actually passed an exam in Japanese proficiency called JLPT. And then to this day, he hasn't paid me. I don't know what happened. But yeah, that was probably the best bet I ever made because after that, I got invited to Tokyo the first time to learn neurosurgery, met my best friend in all the world, who's now my roommate, Hibiki. And then we co-wrote that article together that we made for the website for you. And then, yeah, he's my partner in crime. He's my confidant. When I'm not sure of something, I can ask him.
Hmm.
Vice versa, it goes both ways. And then, yeah, just fell in love with this country, and the rest is history. Went back and forth. Now I'm a resident of this country.
All right. And I think we mentioned offline that I visited Japan a few months ago with my family and completely agree with you. Fantastic country. Would love to go back. Now, in your article, you contrast the American and Japanese healthcare systems and what we could learn from that. So, for those who didn't get a chance to read your article, tell us what it's about.
Well, yeah, like if you're interested in medicine from a different perspective, like a non-Western, I know a lot of medical students, myself included, from the USA, we like to go to England for study abroad, like rotations. We like to go to Australia or Europe. Going to the eastern side of the world, whole different ball game. It's like going to another planet in a way. Well, Japan and the USA, they share many similar problems right now when it comes to healthcare. Chronic health conditions, an aging population, but one thing Japan works at well is like just like England, they have socialized medicine. So yeah, Japan, similar to the NHS over in England, it's a government-run healthcare socialized system. However, there are some caveats, like how while in the UK they don't pay for anything, it's free at the point of contact, it's government-run centralized bureaucracy. Japan, I'd say it's more of a hybrid system between America and the UK, kind of like Australia, which is also a hybrid system of America and England. And so every Japanese citizen from birth, they're automatically enrolled in national health insurance. They don't have to worry about, hey, can I see a doctor or not? You're born here, you have citizenship, you will see the doctor. It's just a question of do you pay 30% copay versus the full 100%? The government usually takes care of that other 70. But even that other like full price, if you can't afford it, or let's say you're visiting Japan like I was before I got my residence card, you would be surprised what the price is. So like an eye appointment for these glasses, for
Hmm.
example, for an ophthalmologist in America, if I didn't have insurance, I'd probably be paying just for the visit, $200 to $300. Japan, even without insurance, the most I paid for that ophthalmology visit just to get new glasses, $50.
Hmm.
And then even without insurance to get these glasses as well, the max it cost me was 250 just for the basics. If I wanted to add on stuff, I'd pay extra. But even the most basic set of glasses will cost 200 without insurance. With insurance, according to my friend Hibiki, you'll probably pay about 50, $75. America, I don't want to think about what this would cost. One way that's different from UK, so Japan, it's not centralized. Just like us, they have a vast different network of insurance systems, of like, I don't know, what's it called? Like audits and basically just people inspections and everything else, just like America does. Oh yeah, creditors. Meanwhile, UK, everything's run from like London or Liverpool and so on and so forth. So you have to go to a GP first, only then can you see a specialist. Japan, you don't have to do any of that. And yet they have more efficiency compared to England. But at the same time, because of that non-centralized approach, they do have the same rural-urban divide as America does.
So, in terms of some of the biggest things that we in the United States can learn from Japan, number one, of course, is the prices. Number two is kind of a bigger public responsibility when it comes to healthcare. It seems like in the United States, we've been dealing with these potential solutions for a while now. So now that you've lived in Japan, like, do you have any advice for our healthcare leaders in terms of how we could implement some of these ideas from abroad?
Well, I think so. Yeah, there's two specific things I can think of. I know AI is gaining traction in a lot of fields, including medicine at the moment, especially in America, in terms of medical education, in terms of like improving like outflow, like discharge summaries, patient notes, pharmacy records, everything like that, and also just teaching the stuff. Like I sometimes use ChatGPT to help me learn medical Japanese because that's a whole different ball field from basic conversational when I'm going to a supermarket or like to a restaurant. And so, yeah, that's one big thing I'd say we can implement more. So one thing the Japanese are doing with AI, they're not as like big on it as we are at the moment or as the West. They're a bit skeptical, but they are looking at ways, how can we implement it into social care? How can we, I don't know, merge it with robotics to do surgery and all that other stuff that the USA is doing, medical education, getting notes ready, translation services, for example. Like sometimes foreigners who don't learn Japanese, they might, it's like, I don't know, idioms or certain things do not translate, and vice versa when I was learning it. So that's one thing. Second thing I can think of is elder care. So yeah, Japan is an aging society. I'd say a lot more than we are, but we're catching up, unfortunately. And so they've actually had to like tackle that problem head on in
Mhm.
terms of like social services, nursing care, like just like home visits, that kind of thing. And AI is also assisting in that department because if you go to a Japanese restaurant, I'm sure you've probably seen like a robot waiter, right?
Mhm.
Yeah, so that's one thing that they're trying out. And so, yeah, I'd say the elder care model, it's actually been started in the UK NHS. Like they've actually taken some of that and they're just experimenting with it. USA could be next.
What's it like to be a doctor in Japan? Tell us about some of the rewards and challenges they face.
Well, I'd say the biggest challenge at the moment is the language barrier, which emo. So I'm trying every day to study Japanese so I may pass the license exam. But yeah, I'd say my level right now, having passed N3, that's like the intermediate level, I can talk at a high school level. And so sometimes I have to still draw it out, go across that barrier, like point, I need blood from you, or that kind of thing, or I need a scan. But I'd say it's a lot better than where I was compared to 2022, where it's like, I don't know what this person's saying. But at the same time, it's very rewarding. Like when you see an IMG come to America and they're trying to learn the language, I have some understanding now, some humility of how that feels. Like I'm the fish out of water. Like no one's going to learn English for me. Like they can speak English, my coworkers, but you should make an effort now that you're here. And then it's been very rewarding. It's like being on another planet compared to like if I was in Europe. But at the same time, it's like once I cross that barrier, once I can fully understand a patient and write a note in Japanese for that person's condition, it's very worthwhile. It's like I've already studied medicine, I've had to learn antibiotics, I've had to learn anatomy, I've had to learn surgical procedures, complications. Now I've had to translate it nonstop. Like, I think I have an example for you here.
Hmm.
Yeah, and so just trying to get through that day by day and then learn the details. It's just been a very, I don't know, blood, sweat, and tears process, but also very rewarding at the end of the day or the month.
Now, how about your physician colleagues in Japan? I know that physicians in other countries, like Korea, for instance, there's a lot of dissatisfaction among physicians. Talking to your Japanese physician colleagues, are they generally happy with the system?
Yeah, that's another issue I feel like they could probably learn from us about. So, yeah, burnout is a huge problem, not just in medicine, but in every aspect of Japanese work culture. It actually has a term called karoshi, death by overwork. So, some people literally work themselves to death rather than the traditional like suicide because God forbid, like it becomes too much for them. It's just like I'm gonna stay and work until the point of which I collapse from a heart attack or collapse from some other long-term medical complication. And so, yeah, that's still a major problem, but I'd say 2025, it's starting to loosen up a bit. Maybe not as much as we are, but it's a different culture, it's a different perspective. I know it's going to be slow to change. Like, who am I to decide, hey, you should do that? Like, from a Western perspective, like, I'm not from here, I'm not a native, still learning your language. So, try to understand that gap. It's like they see this as normal, but at the same time, one of my colleagues who's actually spent time in America, he's like, yeah, I agree. This is not healthy. This cannot go on because if people keep dying, who's going to take care of them? And aside from the usual, like you have to take care of yourself, like you need to be healthy yourself. It's just like if you die on me, I'm a man down. So that's one big incentive why they are thinking okay, we need to start like work-life balance better. We
Hmm.
need to work on physician burnout. And then me being from an outside perspective, they're like, what are your thoughts on this?
One of the things that your article highlights is the concept of medical Bushido. And can you explain what that is and how that shapes the physician-patient relationship?
Sure. Yeah. So I've actually lived a little bit of it now, being here for a few months, like witnessing it firsthand. So kind of like, have you seen that movie, Tom Cruise and the Last Samurai?
Hmm.
Yeah, so it's kind of like a slow metamorphosis over like months, if not years. I'm not at the years level yet. One day, fingers crossed. And so, yeah, it's like I'm still learning the hallway signs and everything else. After being here, it's more muscle memory than simply reading, but I've gotten better at the reading I don't know, the various specialties as I'm going around the hospital. But yeah, so at the beginning, it's like I figured, okay, I come in, someone's going to have the reports ready for me, someone's going to have the handover ready for me. And then if I order an x-ray or if I need a procedure, one of the nurses or nursing assistants will handle that. And then I try to say it in rudimentary Japanese. Sumimasen, kono shidenzu onegaishimasu. Like, I need this EKG. And they're like, okay, go get it. It's like, what? Yeah, and then like my senpai or seniors pulling me over, it's like, oh no, no, we have to handle that ourselves. So it's like every day you come in, you pull up the list, you see what needs the problems, just like America. But then if you need something, if you need a test like a nerve conduction study in neurology, you're going to perform the test yourself, you're going to interpret yourself. If you ask for radiology, they're not going to automatically hand you a report. They're just like, okay, here's the image, you do it. So it's like very hands-on, very like you have to put the work in, kind of like a samurai. It's not just like, oh, someone's going to sharpen your sword for you, someone's going to have your armor ready. It's like, this is your job, this is your equipment, this is your duty. You take care of it from like step A to step Z. Like you'll be involved in every step of the process, which is contributing to that burnout, which I mentioned earlier. So I'm telling them, hey, maybe we should have someone relegate this to a nurse, or like, I understand we need to like look at the x-ray. We need to be able to see that in case a radiologist can't give us a report, it's not ready in time, this is emergency. But the maybe like if it's non-urgent or if it's a routine thing, they could take some of the workload off. And so that's not something they're used to yet, but it's like something I just suggested that's like a very simple, straightforward thing you could do to make things more efficient. I know you guys love efficiency to make things less hectic for us, but I'd say that like duty to care is very ingrained. Like I've seen one of my senseis come start his day at 6 a.m. and then he's there until 11 p.m. almost every single day.
one of the things I want to ask you is about primary care. In the United States, there is a 70 to 30 ratio in favor of specialists. And that ratio is flipped in countries like England, where there's more primary care clinicians than there are specialists. What's it like in Japan? Do they value primary care? Is it easy to find a primary care clinician? What's that primary care specialist ratio like in Japan?
I'd say it's more like if it's 30/70 in America and it's flipped around in England, like 70 primary, 30 specialist, Japan would fall more 60/40 for primary specialists because so the training pathway in Japan, it's historically heavily influenced by England, by Germany, by European countries. Just like in Europe, just like in India, just like Australia, they start medicine right after high school. It's a 6 year degree, like an MBBS, not the BSMD or
Mhm.
BAMD like we do. And so yeah, after you do that 6 years, then you're 2 years kind of like a house officer in England. You're doing like 4 months in gynecology, 4 months in internal medicine, 4 months in surgery. And then the next year, you're doing 4 months in psychiatry, another specialty, and so on. So yeah, it's very similar to what the British do, and then what some of the Europeans do. Then after that, if you want to specialize in, say, neurology, you're going to do some core internal medicine, just like England. Then you're going to do neuro. So the whole process, I think one of my fellows, it took him anywhere between 6 to 8 years to qualify as a specialist in neurology. So he had to go through that internal medicine pathway first because one, you're still expected to take care of primary issues in a neurology patient like AKI or pyelonephritis or something like that. And then at the same time, Japan's like, we still need primary care, so we need bodies. You can specialize, but for a few years, you belong to internal medicine.
Mhm. As far as you know, are there current trans-Pacific partnerships as it relates to healthcare between the United States and Japan?
Yes, for both research and clinical. The most recent one I can think of, when that pandemic hit, I was just starting medical school in 2020. Just like everyone else, it took a huge hit on my mental health, not being able to leave the house, not being able to go through the normal traditional lectures and classes like everybody else before me or after. So, yeah, we were the first group to really feel the full brunt of that. At the same time, I think my Japanese counterpart and my roommate, he was like finishing his senior year of high school, about to apply to medical school, and so that really affected him. And mental health's already a problem in Japan, so add on top of that, you're trapped in your own home. So the COVID vaccine, Japanese companies and US companies definitely collaborated there. Another famous partnership in medical research, after we dropped the atomic bomb on Japan, the long-term effects of radiation, of dropping hopefully this once in a lifetime event, like we're still seeing the fallout. Japanese clinicians, Americans, they still talk to survivors, they still look at the historical data, and they're still compiling, hey, what are the long-term effects of dropping a giant lethal weapon of mass destruction the world has never seen on this city?
We're talking to Vikram Madireddy. He's a neurologist. Today's Kevin MD article is How Japan and the United States Can Collaborate for Better Healthcare. Vikram, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Mhm. Okay, so I would say, yeah, Japanese medicine, learning from a different perspective, a non-Western side can really open your eyes. It can really help you learn patient empathy because there's a bigger gap versus going to a European country from America, going to another Western country like Germany. And then at the same time, some of what they do, their out of the box thinking, their mentality, their culture, how they approach a medical question or a research question, that could help clinicians in America in terms of like how they practice medicine, how they approach medical research. And then finally, it's always good to just see how medicine is practiced on the other side of the world, or how just in, even if you're not a clinician or a doctor, just like how this country lives, how they operate. Because when you meet a new person, you finally have that new perspective. It's like I always assumed like, hey, I'm just living in my American bubble. Why can't they learn
Mhm.
English? Or well, like, isn't this like we're overwork culture, this suicidal mentality, like this is not healthy. And it's like to them, it's completely normal. And then if you live amongst them for a while, you finally see that, and it's like maybe I can figure out a way to explain to them, hey, your life is worth living, for example, or this is a unique way to approach that. Thank you for teaching me.
Vikram, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you for having me.